Hi guys, today on this channel I have an unusual request. Please send this video to your village people. Yes, it directly affects them. And please, if you live in Africa or any other place that malaria or tuberculosis is endemic, you want to watch this video to the end. So today I came to talk to you about splenomegaly. Splenomegaly is simply the medical term for an enlarged spleen. So based on research, I did my research and a little digging. So there's still places in Nigeria that go about treatment of this condition the native, the traditional, the crude way. So I came to educate you on this. And for some people, I don't know if you've lived in a public space, maybe a dormitory, school hostel, you may have seen people with these markings. I'm going to put it somewhere on the screen. So these are called healing tattoos. You may even have one. So watching this video is going to give you closure on that tattoo you have on your stomach that you didn't really get full explanation to why you were given that tattoo as a child. Please note, this condition can affect people of different ages, but it's mostly seen in children. Most of these cases occur in children, but it can affect anyone of any age group. So please, you want to watch this video to the end. This condition is so severe, it's so serious. In fact, while I was doing my research before making this video, I discovered that a musician in a country, I couldn't get the country, so a particular musician just died of chronic splenomegaly. It's that serious. So please, you want to watch this video. Okay, so the healing tattoos I was talking about, it's mainly done by the Ishan people of Edo State. Like I said, I'm going to put a picture, photo credit to who owns that picture. So I'm going to put a picture of this healing tattoos. So what happens basically is that the child gets like a swollen stomach, which is like a symptom of this condition. So the child gets a swollen stomach and they give the child those healing tattoos. It's called I think Ude markings. I don't know if you're from this part of Nigeria. Please, you can shed more light on the name of this healing tattoos. Splenomegaly is a medical term for an enlarged spleen. Now the spleen is an organ that is located in the upper left part of the abdomen. It plays a vital role in filtering blood, storing red blood cells, and also aids in immune response. Now, the spleen can get enlarged for a number of reasons. The first reason is if there's an infection. It could be bacterial, viral, or a parasitic infection, as seen in conditions like maybe you have malaria, you have tuberculosis. That's why I said if you live in an area that malaria is endemic, you may want to watch this video. So what this does is that when this infection starts disturbing the spleen, it causes an immune response. So the stress on the spleen to destroy this damaged red blood cells causes it to expand. That's why you see the swollen tummy as a symptom. Other conditions that can cause splenomegaly are like a liver disease. If you have liver cirrhosis, or you have cancer, or even portal hypertension, you stand a risk of having splenomegaly. Also, if you have blood disease like sickle cell anemia and thalassemia, or you even have cancer itself, some metastatic forms of cancer can cause splenomegaly. Infections like mononucleosis, tuberculosis, or even forms of cancer like leukemia. Also, if you have any inflammatory disease like arthritis, lupus, or some genetic disorders like Gaucher's disease, can cause splenomegaly. Now, symptoms of splenomegaly include: the first symptom of splenomegaly is actually pain in the upper left quadrant of the abdomen. That's where the spleen is located. You may also notice fullness or swelling, discomfort in this part too. You may notice fever, weight loss, easy bruising. You may also notice fatigue. So these are symptoms of splenomegaly. Diagnosis is typically done by physical exam. When you get to the hospital, they'll check for pain in that area. That's the first line of examination, a physical exam. Imaging tests are done, typically an ultrasound to visualize the spleen. Blood tests are also done to be able to dictate the underlying cause of this condition. Typically, a liver function test to determine the underlying cause, maybe an infection, a blood disease, or even cancer. For treatment, the underlying cause of this condition is usually addressed. Maybe, like I said earlier, it may be an infection, a blood disease, or even cancer. So the underlying cause is usually addressed. Also, in some cases, a splenectomy may be done. That's total removal of the spleen. Then in some cases, supportive care, that's to manage symptoms and complications. So it is important that you seek medical attention if you experience any sign of splenomegaly, especially the swollen tummy I talked about, because it can also be like a symptom of other conditions. Also, if it's actually splenomegaly, the underlying cause may be as mild as malaria or as severe as cancer. And you know that if caught early, you have better prognosis. So it is essential you seek help early. So if you have any of the symptoms, you should go to the hospital. Do not go for Uday markings. Do not go for what do they call it, healing tattoos, or I don't know, just go to the hospital. That's it for this video. I hope you stop by next time. I hope you got value, and I'm sending you love and light.